Whether it's having babies or we just weren't blessed with much, breast augmentation is something so many women think about. Dr. Thomas Kotoske, he's the medical director of the Cosmetic Surgery Institute. He's here this morning to talk about implants. And you've even brought a display. And
yes, I have.
People are coming up, can we touch it? Can we feel it? So these are the latest. There is so much new with breast augmentation. Tell us some of the latest trends that are out there right now.
Well, we have so many innovations that have occurred. And we've gone from the saline implant to a moderate profile implant, high profile, ultra high profile implant. And they've all provided different elements that really can help us succeed to get just an absolutely beautiful result.
Right. We've heard a lot about what's called this memory gel. Tell us what that is and the advantages of that.
Well, you know, we start off with saline due to some issues with silicone in the early years, and we've migrated to a cohesive memory gel, where this implant will stay pretty much the way that it's placed in the pocket, excuse me. But it allows us to fill the upper aspect of the breast, to get the nipple tissue up, to get a very beautiful look with no ripples, wrinkles, things of that nature. So it's been a fantastic device.
What about movement? Because a lot of times you heard women talking about, oh, they're moving or they burst, and this seems to be giving a little bit away from that.
Yeah, you know, we dissect the pocket just large enough to, you know, place this implant in the appropriate position. We do measurements preoperatively, but this implant pretty much stays exactly where we need it to be to give the best result.
So who's a good candidate for breast augmentation?
Well, you know, all women that need reconstructive work or have breast asymmetry of many different ages. You could start in your 20s, move all the way up to your 60s. I mean, our society has so many different facets where people are working out, taking care of themselves. So the older age population is actually opting to do augmentation these days as well. But primarily 20 to 50, up into the 60s, we see patients that will come in for that.
We're looking at some before and afters, and I can only imagine for women who have spent their entire life not having the breasts that they've always wanted, you are giving them a restart. You're hitting the restart button for these ladies.
Absolutely. And you know, it's great. I feel very fortunate to be able to do that, but it's just great to see the look in their eyes once this is done and we've taken care of some of their issues.
And so many people want it to look natural, and that is what we see in a lot of these before and after photos that you're showing us, because we don't want to look like we had something done.
Right.
We just want to enhance maybe what we currently have.
Exactly. I mean, our goal is listen to the patient and then take that, develop a treatment plan that basically allows us to, you know, reach the goal that they're looking for.
Now, I know the memory gel is what we're specifically talking about today, but you still offer silicone, you still offer, you know, the saline, you still offer all of these different types of implants,
Absolutely.
correct?
It just depends on what the patient needs, and that preoperative assessment is key. Listening to the patient and then doing measurements and then making the appropriate decision.
Well, that's what I was going to say. So you will look at a person if I walked in to see you, and you would suggest for me what would work for me?
Absolutely.
Okay, so
Absolutely.
we need to not come in with an idea of what we want. We need to allow you to do your work.
You know, both things, they work in unison. I will listen to what you have to say, and I'll do my best to create what you're looking for. But oftentimes photos, prior work helps a patient to truly understand what they can truly achieve.
Well, it's remarkable how revolutionary a lot of these implants are. I mean, to go from, you know, from this to this.
Absolutely.
I bet it's been fascinating for you, too.
It's been excellent. Yeah, I mean, it really has made my job easier in some respects, but it's just enhanced the quality of what we do.
All right. Well, thank you so much. I want to give you a special offer now. Dr. Kotoske did bring a special offer for the implants, and there it is. The saline implants, $3,999. You can get the silicone implants for $4,999, or you can get the re-augmentation for $4,200. Make sure that you call for all of the details. Cosmetic Surgery Institute is located at 19636 North 27th Avenue, Suite 101. To make an appointment today, give them a call, 623-516-2639, or you can visit them online, bodybykotoske.com.